may join if possible for him. And I also welcome the today's speaker, that is resource person, Dr. Sujay Kar from Apollo Hospitals, Chief Medical Information Officer and Vice President of Apollo Hospitals Group, Hyderabad, as speaker of the today's program. That is, he is going to deliver his talk on artificial intelligence, AI, and its impact on healthcare services. So, respected Vice Chancellor, Director Academic, Registrar, members of the IIC, committee members, ladies and gentlemen, it is with great pleasure and welcome you all to this inaugural session of the webinar on the role of AI and its impact on healthcare services. Today marks a significant moment as look into the transformative potential of AI in revolutionizing the services or service delivery in general and healthcare delivery in particular. As we stand on the threshold of a new era characterized by unprecedented advancements in technology, it is imperative that we harness the power of AI to address the pressing challenges in healthcare sector. From diagnosis to treatment, AI holds the promise of enhancing efficiency, accuracy, and accessibility in healthcare services, ultimately providing or offering patient outcomes and quality care. Throughout this webinar, we'll engage in insightful discussion, exchange of ideas, and explore innovative solutions that leverage AI, artificial intelligence, to optimize healthcare delivery. And our esteemed expert will focus on the latest developments, trends, and best practices in this dynamic field, inspiring collaboration and driving progress towards a healthier and more sustainable future. So I extend my sincere gratitude to all the guests, Vice Chancellors, Professor K. Sitaram Rao Garu, Professor Pushpa Chakrapani, Director Academic, Professor A.V.R.N. Reddy, our Registrar of BRAOU, and all the guests, IIC members, today's speaker, participants, and organizers of this program. Let us embark on this journey together with curiosity, innovation, and a shared commitment for harnessing the transformative power of AI for a betterment of health care worldwide. So it is in this context, before the talk, now I request guest of honor, Professor Pushpa Chakrapani, Madam, to give her message in brief about this today's program, and then we'll proceed further. One word.
Thank you, Pavar. Honorable Vice Chancellor, Professor K. Sitaram Rao Garu, Professor Ananda Pawar, Dean, Faculty of Commerce and Business Management, and Professor Y.S. Kiranmayi, Head, Department of Business Management, and all the members who are present here, the Radhakrishnan also, who is the coordinator of this program, and the others who are also joining online and offline. Very good afternoon to all of you. I'm really happy that you have taken a very good topic on artificial intelligence, its impact on healthcare services. We all know the technology revolutions in the present day world, particularly in the health sciences, medical field. We have, a decade back, we have talked about the media services, right? Telemedicine services. So now it is more advancing than the telemedicine. Now all the technologies combined in one place, and the artificial intelligence, by using this artificial intelligence, as if the doctor is near to us, the patient can feel that the doctor is near to that. And also even the doctor very far away, they can treat the patient even with the heart problem also. So like that, there are many activities are there. I'm not that much of familiar of all the technologies involved in the healthcare services, but still I am really appreciate the Faculty of Commerce and Business Management for taking such a good activity. And all the activities I have seen in the calendar, the activities you have selected are very, very relevant and very good to the society and as well as the students of not only Ambedkar Open University and also the students and all the other people in the society. So I have nothing to say than this. And once again, I congratulate you all. Thank you.
And sir, this program, thank you, madam, for the message. And sir, this program is taken, today's program, the artificial intelligence and its impact on healthcare services, keeping in view of the National World Technology Day, which is taking place tomorrow.
Okay, okay.
So tomorrow is being a holiday, so we plan to have program today, a day of preponement. So it is in this context, this topic is taken, and we approached the Dr. Sujay Kar, who is an appropriate person, we thought, and he has given the title, which is related to Technology Day. And then now I request our Chief Guest and Vice Chancellor, Professor K. Sitaram Rao, to address the gathering. And for this program, all MBA HSM students are there in the
students.
Yeah, students, all program centers we have informed. And the teachers of the, it is around 20 plus now. I think they are now joining.
I think
okay.
Yeah, speaker must be waiting.
Yeah,
it's better to start.
So now I request Professor Sitaram Rao Garu, our Vice Chancellor, to give his message.
So once again, I thank and congratulate the Department of Management and Commerce for starting this program as part of the guidelines given by the AICT. This establishment of this IIC is most important step ahead for making the institution more relevant and also activating the staff as well as students to involve themselves, to encourage the students to think in a new creative way, keeping in view the problems around the society. Ultimately, whatever the subject we teach or learn, finally, it is relevant to the welfare and development of the people of the society. So keeping that broader objective in view, whether it is a business management or physics or chemistry or public administration, whatever it is, we have to think in terms of the well-being of the people in society at large. So healthcare management is also one of the very important area in which we are providing MBA program. So this impact and relevance of artificial intelligence, providing most appropriate and patient-centered health services, how best we can make use of this artificial intelligence is also one of the important challenges before us. So I don't want to take much of your time. So our honorable resource person, Dr. Sujekar, is there, having most and lot of experience as a Chief Medical Information Officer and Vice President of Apollo Hospitals, to enlighten us on this important area. We are also very new to this subject, sir. We are very much keen to hear you and also learn many new things out of this webinar. Thank you very much. Thank you once again.
Thank you, sir, for gracing the occasion. Now I request Professor Kiran Mai, Member Secretary of the IIC, to introduce today's resource person and invite Dr. Vice Kiran Mai.
Thank you very much, Professor Pawar. It's my pleasure to introduce Dr. Sujaika, resource person of today's session. Unfortunately, he could not join through video because it seems there is some problem with his camera. That's why sorry sending a message. Okay. So we can only hear him but could not see him. Okay. Dr. Sujaika is the Chief Medical Information Officer and Vice President at Apollo Hospitals. Previously, he was a Director of Medical Services at Apollo Clinics Hospitals, Calcutta. He obtained his postgraduate MD in Clinical Microbiology and Interface Diseases, and he's an alumni of MIT School of Management. He's a certified Six Sigma Master Black Belt, ISI, and member of professional organizations like American College of Healthcare Executives, APHEs, AR Association, Member Healthcare Subcommittee, College of Healthcare Information Management Executives, CHIME, SIG, International Hospital Federation, and Digital Health Technologies, DHT, Advisory Group, World Economic Forum. Dr. Sujay is currently associated with IIM Calcutta and IIT Kharagpur as adjunct faculty for Healthcare Analytics and Management at Apollo University as adjunct professor for Health Sciences. He has led teams in multiple award-winning patient safety and process improvement projects. His current and ongoing research interests are in the adoption of artificial intelligence in healthcare, time-driven activity-based costing, living labs, digital health platforms, and design thinking in healthcare. And this is a very brief biodata of Dr. Sujay. When I asked him, Mrs. Sir, when I asked him to share his CV, he said, Madam, it turns into pages. You want a bite or full CV? Then I said, only bite is enough. So this is a bite of the CV of Dr. Sujay. So thank you very much, Dr. Sujay, for accepting our invitation to be the resource person for today's session on artificial intelligence and its impact on healthcare services. Now I request Dr. Sujay to start your presentation.
Namaste and good afternoon, respected Vice Chancellor Sir, Deans, Directors, Registrar of a very, very prestigious university in the name of one of India's, architect of India's Constitution and the forefathers of our independence movement. I feel very humble and honored, deeply honored, to actually come and talk about this particular topic here today. When Professor Kiranmay reached out to me and said, "Sujoy, would you do this, do this presentation?" My instant reaction was, yes, I want to talk about it. Just because this is a time when we all are getting acquainted, we are all learning. And I am here to share whatever that I could learn in a span of next 25, 30 minutes with my dear students and of course the faculty of such prestigious university. In order to share with you, the work that we have been doing and it is shaping both from a clinical perspective and also from the perspective of, from an operational or from a healthcare perspective, healthcare operations perspective going forward. So I'm going to share my slide and I hope you can see my screen. Kiranmay ma'am, can you see my screen, my presentation?
Yes, ma'am. Yes, sir.
Yes, thank you so much. So I thought I would talk here a little bit about how do we navigate clinical artificial intelligence. And I heard Vice Chancellor Sir talk about it. And he said, how do we go about in improving accessibility of care? How do we take the innovation to the bedside, to the last mile of patients who are not only in tertiary care hospitals, whether it is private or public, but about the people in the community, people who are who require care at their doorsteps. And that is where has been the endeavor of technology to actually take it. I also heard Madam talk about telemedicine and the impact that it could do from starting from very simple consultation to cardiovascular disease, as she was referring to, if there was a heart patient who had a hole in their heart, how telemedicine actually helped. And this is the endeavor of Apollo Hospital, vision of our respected chairman, Sir Dr. Pratap Reddy, that we started telemedicine in India way back in the year 2000. And, when Bill Clinton was here in Hyderabad, and that was the exact use case where we could identify a patient with a hole in the heart by doing telemedicine and tele-echocardiography at that point of time, way back in the year 2000, 24 years back. So the technology by that time has evolved and it has become more and more interesting. I use the word interesting because there are extremely novel and extremely good impact of these technology in the way we are looking at. But then there are also certain guardrails that we will have to prepare. As I was just getting into the call, VC Sir was talking about frameworks that are given by different institutions. We need to talk here about how do we develop the frameworks of AI, particularly in leading to clinical usage at the bedside or wherever we are seeing patient. So my talk today would actually involve how do we navigate, how do we take the clinical AI appropriately to improve the impact in the healthcare services, and which are the ways but we are doing that. For my dear students, I would always say, let me start by looking at certain basics and the hygiene. And you will see more and more as you get involved into this about the building blocks, talking about how do we look at the suitability of clinical AI with bringing in ideation, design, engineering, development, validation, and integration for enhanced usability at everyday clinical issues. So if you look at it from that perspective, I would begin by saying, how do you go and conceptually design a program on clinical AI, or for that matter, in generalized way, AI in healthcare? So we have now, looking at various institutions across the country, we now have good electronic medical record that are being developed and now being used more and more. So we are now getting data around patients' interaction. What is patient interaction? Where you are capturing not only about the patient's admission, discharge, transfer, or OPD prescription, or scheduling or appointment, but you are also beginning to collect data around the clinical interactions in terms of what his height, weight, BMI, blood pressure, temperature and others, then his lifestyle, then his patient's family, his family history, his social history, his history around his current illness, and how do we go about in giving him appropriate medication tests and others. Now, imagine that all of these data has been stored in systems for years now, and you can use this data as signals to actually see what do they mean. Normally, in healthcare, we have research which happens. We have research which happens prospectively. So which happens prospectively, where you go about and you have a medication and you do the clinical trial, you would have a dummy or a placebo, which is like a dummy medicine, and you would test between the two medicine, which is more effective, and take it forward. But then the retrospective data that is lying in electronic medical record for years are also treasure trove from which you can actually look at and understand disease progression. And I would spend about a minute here about the data structures that we are seeing. So one is the data that you collect in the electronic medical record in the form that you see how the doctor does daily interactions with the patient when they are admitted in the hospital, or the nurses do it, or other healthcare workers do it. And then on the other side, you have a lot of images that are generated in terms of, say, X-rays, mammograms, ultrasounds, and so on and so forth, and going up to MRI and CT scans and others. So you have images, you have electronic medical record where you have all the lab values, medication used, and other things. And then now you have more and more deeper data that are coming. They are very high volume, high velocity, high variability, variable data. And these data are coming from, say, videos of surgeries that you are doing. Then, of course, you would have data that are available from the genomics. Then the data that are available from the wearables that you are wearing. Many of you are maybe sporting at this point of time some smartwatch. So you are getting signals from them. All of these data can be stored and seen on a longitudinal basis on the fourth dimension of data, as I call it, on time, and see how diseases are progressing. So if somebody has a diabetes 10 years back, where is he now in terms of his cardiovascular health or kidney disease or liver disease or his liver conditions at this point of time? Mathematically and statistically, these days, we are able to identify them and use them prospectively for using clinical AI. So, in that context, the step one is to come together with a team of doctors and engineers and do an ideation to see what is relevant for a healthcare improvement, or where will you use AI in healthcare, whether it is in a process, whether it is for a public health problem. We know that there were a lot of AI that were coming up when we were having COVID about 3 years or 4 years back. And how did they fare? I will tell you in a while. Then, of course, once you have identified what is the problem statement, then you go into your data repository and look at what that you can build out of it. What is your data saying? And you will see while doing the data management that there will be a lots of problems. You will find that some of the data are not entered properly, or there are missing data, or the data are not normalized. And then you will have to do a lot of data engineering on top of it to bring it into a proper shape, and then run quality tools to see whether they are good fit to do machine learning. Once you have done that, you move on to analysis and modeling using a step-ladder fashion, where you begin with very basic tools and then go and use advanced tools. And there are lots of advanced tools that are available in deep learning, reinforcement learning, generative AI, and the science is changing every possible minute, if I may put it. You would be using those tools from the libraries and making it. However, in doing so, one of the things that you need to understand is that how do you use ethical principles in building these AI tools and using them particularly at the levels of care. And that is where the maximum number of challenges. This is where you would have to go to your institutional ethics committees or ethics committees of the hospitals and then take their appropriate approval. You would also have to register with institutions like ICMR, CTRI, where you have to go and say, I'm doing this research, and when I get the results of this research, it would be important for the community to take it and build upon it. That's why we do research, right? Somebody has done the research, and then we want to go on top of it and build on top of it, and make the way we want to go about in topic, do what we call as the breakthrough innovation for a particular field of science. Now, what you have built in your algorithm, or what you have built in-house or with a particular data set, may give you a super performance. And it normally would do, because you will use all your practical understanding, domain knowledge, engineering knowledge to build a very good machine learning algorithm. And I hope many of you code, and you will be able to do it very well. So I'll talk about that in some time in my lecture. Now, the next step is you would need to understand the value of validation. What you did in your labs is it good enough to be practically used? You will have to then go out and do this validation in out of sample data, whether it is within your own organization or whether you have tie-ups with other organizations in India or abroad, and do these, tie-ups with them to understand how your algorithm can be validated with their data and what results it comes. That is a very, very important steps, and you require now, because we are in the age of data privacy and data confidentiality laws. Government of India last year, came out with a law for the DPDP, the data privacy law. So you will not, and many of the other countries, whether it is the HIPAA law or the GDPR law in the HIPAA law in US or the GDPR law in the Europe, you would have all of these laws saying that you cannot share data just like that. You would have to anonymize the data. You would have to host the data in the local servers, and then you allow federated learning or confidential computing on those data sets. Now, what is these? Possibly it is beyond the purview of today's lecture, but if many of you want to learn more about it, I'm more than happy to come visit our labs and we will explain you how this can be done further. Now, I want to go to the next next 5 steps. Once you have got the validation results from the other institutions as well, how your model or algorithm is performing, then you can go about in public, doing your publication, doing your presentation. Then you can go about in integrating into your electronic medical records, and then build consortiums or networks where you will be able to give these solutions to others and make use of them. But in doing so, you require a lot of regulatory clearances, like CDSCO filing for India, US FDA clearances for United States and others. And then you can go about in using, if you want to use your AI tools in commercial platform. Now, if you are not doing that, then somebody is bringing their tool to come to your institution and use it with your patient. So when somebody comes and does this to your, comes to your institution or comes to you with an AI tool, you must know that they have gone through all of these process to make this or bring this to you. And that is a lot of hard work that is required to reach to this step. But let us talk about this. At the end of all of this work that I have told you, at the core of doing a responsible AI or a responsible clinical AI is all about how do you build trust in the system. Sometimes AI can give you super results, but it can also at times not give you correct interpretation. And that is where, we have all of these things where people become doubtful about the actual use of AI, particularly in clinical field. And you would have to then make your AI much more responsible, much more explainable, and in a way where you are dealing not just with the machine, but also understand that the primary purpose of this is to deal with a human being. And that is why it is very important that we need to build trust to bridge algorithms to doctors or clinicians in clinical AI, and from doctors or clinicians to the patients through, consents, considerations, privacy, and of course, confidentiality. I will give you some examples, about why some of the top AI work that had happened did not do very well in the clinical field. And I always talk about this in terms of trust, about nothing about me without me. You cannot discuss anything about a patient when the patient is not around. Even if it is a little child, sometimes you will have to do a bit of explanation to what is actually going to happen, particularly if you're taking a syringe in hand and giving an injection to the child. I always believe that you have to explain what you are doing. If you are doing that for a simple injection, Believe me, when you are taking decision based on AI tools, you need to explain them what you are doing and going forward with that. And one of the other things that comes out in all of this discussion is that then how do we go about in meeting the unmet needs of healthcare world over? And that is what is called as, as a term called the health equity, which is becoming a global challenge, because health equity means an absence of unfair, avoidable, remedial differences in access of care. But sometimes you have to think yourself and say, there are 40% of people across the world who do not have access to smartphones and internet. Now, if they do not have access to smartphone and internet, and if you build an AI tool which is based on your mobile phone and uses your mobile phone for 60% of people in the world, which is a huge population, by the way, you are able to do something fantastic. But what happens to those rest 40%? We need to think about it. We need to identify how do we reach out to those people who are underprivileged, and how do we take them into that. So that is where you would have to say that how do we achieve goals where priorities are entwined with human rights and social justice, economic development. Many of you are students of commerce. Many of you are students of economics. Many of you are students of healthcare management. For your benefit, I bring this slide to understand the perspective of equity and what technology can do or undo by bringing itself into provisions of accessibility of care. And therefore, whenever you choose a technology, look at it from the perspective of human rights and social justice, economic development, and all in the fields that you have to look at. Then, of course, you have to see, are the data that we are collecting in our public or private organizations, do they overcome bias? And, I have some wonderful, work that I'm doing with several institutions to identify where the bias actually creeps in into our system. And how do you go about in mitigating them? And of course, there are technology issues like demographic parity or equalized odds, or there is a wonderful thing that you can actually go and Google. It's called FairLearn, about bias mitigation. But then the concept is that how do you go about in thinking, is my solution biased, or is the solution that somebody is bringing to me is biased and won't work with certain people? And I'll talk about that. I already talked about the gaps between haves and have-nots, which are basically an economic question, but then also have to say that by bringing in artificial intelligence at some point, are you widening the gap for some people? And that is something which is very, very important from a research perspective. I want to give you some example. There was a wonderful dermatology tool, so skin disease tool. And these are all from, MIT Technology Review, my alma mater. I studied at MIT Sloan, and I subscribed to this MIT Tech Review. And from there, after research, I could pick up these things, not so good things, but I thought it is important to put this into correct perspective and in ethics perspective. So if you look at certain of these tools, they do wonderfully diagnose dermatology or skin lesions in fair skinned people. But they would not do a good result for a mother in Tanzania or a sun-baked tea garden worker in Assam or Sri Lanka, or even maybe coffee worker in Karnataka. And that is something where we would have to say, okay, it is only for that group of population. It does not work for other group of population. Now, that is where I would say that we are not doing technical solution for healthcare equity. Then you have to say something like, some algorithms that they developed in one of the most prestigious institutions across the world. And they found out that they were depriving people of readmission for a particular class of people because the algorithm could not pick them up properly. So how do you develop certain, algorithm, even for inpatients, where you do not have these bias, where you select only people who are privileged and you miss out on people who are underprivileged? This is a very good example. And again, from the MIT Technology Review. something where you are doing fantastic results in the lab. But when you go out to roll this out on the ground, you then find that they are not as effective. Because again, the challenge is how the users are going to use AI on the ground, how the internet connection is, very basic thing. And then how do you go about it, interpreting the results of the AI in appropriate way? And I promised you that I will show you this slide. There are hundreds of AI tools that have been built during the time of COVID to catch COVID. This is MIT Technology Review, which says none of them. And I'm talking about including, some of my own work that got published in Nature. It got published a little later, so possibly they didn't find it, but I'm not trying to self-glorify here. But my tool was not used in the 1,000 tools that had come for COVID. Only 2 out of 1,000 were effective. So if you want to go and study this was published in July 30. My paper came out in Nature only in June 2021. July 30, 2021. My paper came out in June to 2021. So possibly I'm spared out of this, but I want you to go and read this out. And this is so exciting that sometimes when we throw technology at problems, it necessarily does not mean that it will give solution. So I've told you a lot of things to scare about the clinical AI. Now let me tell you the good things about it. Otherwise you'll say this man came and he only spoke about things which are scary with the AI. But I wanted you to give this perception that whenever you select a tool, in whether it is about choosing your health or whether you are choosing it about for any other purpose, while you are using AI, you will have to understand that there are pros and cons, and there has to be a way by which you have a proper ethical guardrail before you go about in using it. So how do our doctors feel worldwide? Just like any other human being using AI, doctors also are sometimes skeptical about what would be the patient's outcome. And they are apprehensive on practical accuracy of these, saying, am I missing some patients when I use AI? Am I missing one or two because the accuracy is only about 97% or 96%? And then, there are chances that I may use it in that. Individually, if you look at from a doctor's perspective, the doctor's accuracy may be only about 60%, 70%, but AI accuracy may be much more. But then you are depending on something on an artificial system or a machine to tell you, and you expect that the results would be absolutely accurate to go forward in doing that. Some of the doctors have this convention, have this fear, and I understand that. Then, of course, it is very important for you to start this conversation with them and say, begin adoption of this technology. There, you have to have human in the loop in the system, and then have to also look at it from a perspective that whenever there are errors, you need to give the feedback so that the machine learning take your feedback and improves itself going forward. And that is something very important from a prospective loop perspective. I also look at something which is very important from the minds of people when they look at it. It could be also, am I giving everything out to the machine to decide for the patient? And that is something which is associated with autonomy loss. What happens if there is a mistake? So we need to understand the different interactions between human and the machine, and to say, how do we go about in choosing the best available clinical AI tool that we can actually think of? So at Apollo, we developed what we call as an ethical framework for deciding all of these, and we call it as EASE. And it has an ethical consideration, a perspective of adoption, a perspective of suitability, and a perspective of explainability going forward. So what is in ethical consideration? Now, you know about the clinical ethics, right? Health ethics, where you say, do no harm. So you basically talk about safety and non-maleficence, or I will not do any harm to the patient. Similarly, in AI, you would also have to look at, how do you bring in the concepts of accountability, right? And there are frameworks that have been built. If you go and search Timid Gibru, you will see her famous paper on SMACTR framework, along with others as well, where she talks about how the accountability frameworks can be built to see the journey from the data to AI algorithm to an API to how it goes and gets used in the field and what is the repercussion out of it. How do you then judge this in the 360-degree and take it? Also, I talked about efficacy, accuracy, integrity, fairness, and inclusivity. From an adoption perspective, you have to say whether the systems where you are using are interoperable or not. Do they collect the similar kind of data with which they have been built on? And how do you go about in making it universalized? How do you make calibration and benchmarking? And you say, this is safe. This is why when you take a drug, you say this is a safer drug from the drug A is a safer drug from drug B, and that's why I'm taking it or my doctor has prescribed. How do you do that in the terms of clinical AI? And that is something that we are learning at this point of time. But the most important thing around this is explainability. Sometimes AI can be of the black boxes, and you would see this in the perspective of, say, how these black boxes work. And I talked about already on the trust as to you can now design engineering systems like feature importance or SHAP or others, where you are able to express, or the model is able to express why did they choose what they choose and how they relay this to the physician, and the physician then they relay it to the the patients for their clinical decisions as well. So one of the important things that you would have to look at is how do you go about in integrating the AI into the workflow without disrupting it in proper way. And therefore, I have 5 pillars, which actually comes from, again, one of the MIT's research on digital economy. And they talk about 5 things: operational excellence, or operational backbone that you actually bring into when you go about in using the AI. Share the insights from the data with every stakeholder in the system. And then the third one is to bring appropriate people to platform and to make a positive network effect out of it. I don't want to go into what is a positive network effect. Maybe at some other point we would talk about network effects and the platform perspective as well. But it is about when more people use more of the platform itself for better outcomes, there is a generation of data, there are generation of processes, there are generation of insights, which are very, very highly valued and which can change, as you said very rightly, Visisa, when you were introducing, how this entire, clinical systems are going to change. And to do the change, we require that amount of insights to come, people to join into the platform. Now, in the platform, if you get into that, on the fourth part is about how do you have the autonomy to build more or breakthrough innovations into this platform. And that is very, very important. Sometimes we not sometimes, we always go and find out our own eureka moments in that and say, how do we go about and find something extraordinarily good, which is always a human intention to do good and to do benefit and to take it into that. But don't discount on incremental innovation that are there in the systems, where you can keep on working on top of somebody else's research, do your own research and find out where it is. But that research has to be aligned with your organizational purpose. Otherwise, you may go a little berserk here and there, and then it may not give you the rightful result. And on the fifth, you need to collaborate. And, I heard also about the collaboration from an education perspective, but the collaboration also from the clinical perspectives around with people across the systems to see, how do you build better systems in the organization. This is an education institution, so I will talk about the skill gaps that are there. Because if you do not know how to use a particular tool or an AI tool in clinical perspective, you will add on more of address deployment bias in systems. And we have seen this particularly when it was happening around it was happening around digital transformation for organizations when they actually did too much of they didn't do, sorry, not too much. They did not do optimum training for people before they could give them those systems. And then it was becoming more and more error prone in the way that they have used it in that way. So there is a question that I have to ask, and maybe during the interactions we'll talk. Do you guys then need to learn coding? Just like, there are programs now available across the country where where the 7-year-old or 8-year-old are learning coding or computer coding systems. Are we then asking our healthcare professionals or other professionals to learn coding, whether it is the management personnel or the commerce personnel and all that? Now, this is a question from an institutional level. How do we see it in that way? My stance on this is you may not go and learn coding, but you need to understand what goes on into that from the domain expertise. So if an engineer is coding next to you, go sit with him and ask him what is happening there and how are you building it? Because you may be giving him some valued information about the domain which he may not have. And therefore, getting the best of the two worlds are very important in building better systems that we are beginning to design. And in the design process, and that's why I bring this particular slide, you need to early involve people within your systems and have to look at from a systems thinking perspective where you bring in not just about the elements of design, usefulness, meaningfulness, and stuffs like that, or study about the attitude, behavior, engagement, experience, and expectations of people to give a proposition, but also look at every level in clinical care. What are those factors that are influencing for a decision that has to be made? When you begin to do that, and you will, if I have to do this even after 20 years of my work at Apollo, I will be biased in my own thoughts. So I will have to go and meet the people who are actually working on the ground and take the views from them while building these solutions in going forward. Again, I will just speak thus for the designs and systems thinking, but these are some of the topics that I normally teach at IIM Calcutta or even touch at IIT Kharagpur. And if there are interests here, I could take this further and see, how do we go about in doing this, particularly on a clinical process. I'm coming to the end of my talk, and I want to then bring in, because one of the topics that you talked about is the impact on healthcare sciences or healthcare services. Now, when you do this, you have to look at, if you talk about the experiences of your last visit to a healthcare clinic or a healthcare or a hospital, you may have experiences like long waiting times or sometimes, delay in getting a report, or there could be an issue of scheduling or getting an appointment and so on and so forth. How do we solve this? Now, we, as a practitioner of Six Sigma, and having learned it from one of the best institutions in the country, I believe that there are plenty of tools from Lean Six Sigma principles where you can build in and bring in them together to actually solve this problem. And we have done that. Healthcare organizations across India and world over have used this tool and immensely benefited. However, I think we now need to move on, and we now need to create or get deeper data from across different systems to actually then bring elements of throughput optimization, bring in elements of capacity constraints, bring in elements of disutility within our systems to actually see in a mathematical or statistical way, how do we optimize a throughput? How do we give a patient discharge at appropriate time and he goes home at the appropriate time? How do we look at certain things like scheduling an operating theater? How do we go about in scheduling something like, who goes to an ICU and who does not require an ICU level care, or maybe a mid-level or a step-down care in that? In these perspectives, a lot of work is being done worldwide under the aegis of optimization algorithms, which helps in actually augmenting functions of the hospital and giving much, much benefit. There are hospitals which have been able to, drop their length of stay by almost 1 day or more than 1 day by using these tools going forward. Again, if you want, we can go about in discussing this. So I have talked a lot about the AI. So what is exactly we are doing in these terms? And in that context, today we have certified algorithms that we are using in many different institutions across the world. So we have what we call as the Clinical Intelligent Engine, or a SIMP AI, which you would see in an Apollo 24/7 app. In the top, if you give some symptoms, it will direct you to certain diagnosis and certain tests and others, and also takes you for a consult with the doctor. Then, of course, we do have certain things from longitudinal data, which talks about disease progression in cardiovascular disease, in diabetes, in liver fibrosis, exacerbation of asthma or COPD, or even what is going to happen in kidney diseases or stroke. Then, of course, there are work that we have been able to do in imaging, and there are plenty of work that we are currently working on the images where we are talking about the anomalies of chest X-ray or identifying tuberculosis. So if you see, these are not very big AI things. There are several better AI things that are happening across the world in non-clinical areas. But in clinical areas, we need to identify certain AI tools which would actually augment the functioning of the hospital in a better way or help clinicians make better decisions. That has been the purpose of my talk, and that is what I'm trying to show. And then, of course, in the hospital, how do you choose a better antibiotic? How do you use a tool to determine how the surgical outcomes would be, or even who is deteriorating in the hospital? If you can detect them early and treat them properly, then you stop ICU admissions and so forth and so on. And I talked about the throughput optimization in predicting discharges and using generative AI tools that you can build on that. I'm coming to the end of my talk, possibly my last slide here, which is, in doing the AI, you cannot do it alone. You will have to do it with a consortium, a partner, a group of people who will be able to bring their insight, the technology, the data, in a way where the data privacy elements are taken into care, the anonymization protocols are looked into appropriate way. You have wonderful data sets that are curated and ready for use. And you are able to do some wonderful technological innovations like transfer learning, where you are using certain models that have been used for some other purposes, but bringing and repurposing it for some other models and getting accuracy out of it. This is particularly in images. It works wonders. Also in generative AI, we are beginning to feel how good it is. But then the concept is, how do you then do computing, or how do you build this algorithm or test this algorithm in data which has to be secured, has to remain within the organization, and then how you do the confidential computing on top of it without having to look at the data, without having to transfer the data from one side to the other, and do it with proper consent, ethical reviews, and permissions from the different local and government agencies. That is where the future is leading to. That is where we are going ahead. So if I have to give you the take-home message, the 5 message that I would have to look at is that the time has come to say that AI is a companion for the doctors, and AI would help doctors make better decisions. The second is, it would be required that we all join hands together to build better data consortiums across the world. The third message for me would be then, in that way, how do we go about and leverage the infinite, if I may put it, capabilities of cloud computing and take it further in that way. And then on the fourth message is that where science would go, and many of you would possibly do the research or take this research forward, where you are able to simulate human body out, simulate the human body completely out of the body itself, and then try out on different drug treatment modalities and test it before you actually go and give it to the patient. And I'm not saying that these are not fantasy. There are people who are doing this now and testing them and seeing how good they are. And finally, on my fifth point, which I always talk, that there will be a time where we will possibly get better machines who would be able to get better signals from human body, process them appropriately, and take or make medicines or early diagnosis a much reality. I'll stop there, and I would like to know your feedback, and I would like to also interact for the next 10, 15 minutes. Hope this was useful. Thank you very much.
Jaikar, very interesting, but I have one question regard to AI, because as you said, AI data is neither perfect nor imperfect. Moreover, AI has certain limitations, which creates unemployment, which stops creativity in any human being. It lacks ethics, but more expensive. Then how do we measure and build a confidence in AI, and how do we measure its excellence?
Great question, and I don't discount on any one of these. The words that you said, that it is expensive. There are questions that are asked on the ethical part of it. There are the questions that are asked on from the accuracy part of it. There are questions about, from a data privacy perspective. And then with all of these problems around AI, how do we build excellence? Well, if I would have to answer this, and I say in a very positive way, I would say, it is about time that we look at this technology and build it in such a way where we incorporate all the virtues that we can bring in. And that is why in our ease framework, you would see the first thing that we are talking about is actually around safety. And there is no compromise on the safety or the non-maleficence about what we have to do. And the way we are looking at it is that there is absolutely no doubt that the predictions, the detections that AI do are, and there are multiple research, some of which I may agree, may not agree. That's a different point. But then the question is, there are plenty of research which shows that AI has the capability to provide much more accurate outputs than what at some point or in the perception of a large data set from a human mind, and therefore it is much more effective in that. But the interpretation has to be, again, on the hands of people who are using it. So you may use something like an OpenAI or a ChatGPT or others, and you give certain prompts to get certain tokens or outputs in a way, and you find that it is not suitable. It is not. So what do you do? You go about and use certain more refined prompts and get better results out of it. I think we will have to take the technology as it is at this point of time, and as it gets more and more refined with time, to actually get into a level of accuracy which is comforting for everybody to go about in using that. That's number one. Number two, on the cost. And I think this is a very genuine cost, and we face this all the time, particularly, the cost of computing and others, particularly in that way. So there has to be national outlook into it, where we would have to bring in bodies, bring in industries to have a conversation. How do we take the AI to the last mile, particularly in clinical settings in which we are able to take it to the people who can afford it appropriately? There have been lots and lots of experiments that has gone world over in this, and a successful experimentation. So again, I believe that the cost around the AI would definitely come to baseline in few years' time, and do some, and make it much more democratic in that way, where lots of people can use it. And that's where the excellence lies. It's more and more people that you involve, and more finer your results gets in. More and more your precision and recall are getting improved over and over the use. You get a system which is then looks at the output in a much better way, and that's where we possibly begin to hit the clinical excellence, or AI excellence as that. But I want to give you again a caveat here before I talk about the AI excellence. I want to put it in the perspective that let's talk about digital excellence first. And in digital excellence, again, going back to operational backbone, shared insights, platform revolution, alignment versus autonomy, and use of third-party systems seamlessly in your systems are the ways by which you can proceed and get the best maximum benefit for AI, or make a hotbed for AI coming in next few days.
Yeah. Any more questions from students? Yeah.
Thank you, Dr. Sujay. This is Madhuri here. I have few observations and I want to know, though I am from a Department of English and Language and Literature, my first observation regarding capacity building training programs in AI. You are speaking about capacity building training programs. So I want to know more about that. How we do that? I mean, as a layman, I wanted to understand how in the clinical artificial intelligence that you do. And second one, coming from the third world country, we always see from a fair, you're speaking about dermatology and how AI is recognizing the fair colored skin, I mean dermatology, specifically from one perspective. You're speaking on people from dusky or maybe the semi-colored or the black people may not be included in that. So
Yes.
I want to know more about it, sir. Thank you.
Right. Right. Thank you very much. So I think these are very, very pertinent questions. One is on the skilling, where, and the skilling around the AI is not just about, how you go about in doing the coding, but it's also about how you provide appropriate domain knowledge when you are going into that. You have to understand that the clinical knowledge itself is a very highly, classified or highly highly ingrained or knowledge where it is only available with certain people in certain books and in certain textbooks or in certain journals and all, which normal people outside the clinical fraternity will not even read. And I also have several doubts whether actually the clinicians also read those books at all after they cleared their exams. Now, I don't want to go into that conversation, but you know, uh, what I meant by saying is that how do you get the best of the domain knowledge into the engineering codes that are being developed by getting them better data sets, by giving them the insights when you are building it, whether you are building it for, say, a language translation tool, right? Or you are looking at a tool where you are seeing, making a decision about a care, or you are making a decision about your investment, right? So in all of these, we require a thorough or credible domain knowledge to come in with the top class engineering tools to actually build this kind of better AI systems in doing that. And that is where you would have to bring the experts from both the areas and do that, and take their feedback together in doing this. Now, from a skilling perspective, you need people to do two things. One, first, how to use it. I mean, people learn using the chat GPT by trial and error method, by giving their own prompts and seeing what the results comes. And at some point they will look at, we did the same way when the Google search engine came out. And now possibly all of us are better searchers than, what we were, say, 10 years back or 15 years back. And therefore, I believe that there is a learning curve there in order to do that. And you can train that. You can tell people how to use better prompts and get better results out of it in an appropriate way. Now, the second part of this is around the bias. And the bias is possibly the topmost element, which has a way by which the AI is at this point of time in many ways affected for its scalability in that way. And this bias can come from something like a temporal bias, which is about the time. Something can be from genetic perspective, ethnicity, geography, language. It could be about socioeconomic status and all of that. Now, in order to build the AI tool into all of these, you would have to bring in the quotient of fairness and inclusivity as much as possible. And that is what is something that has been going around in the world as a revolution in terms of responsible AI, at least in our community, to actually see how do we then get access to those diverse data sets. When you talked about the color of skin, how do we get the diverse data sets from certain part of the world where you have people with darker skins? Or you would get it from certain elements, particularly from admission or discharge of patients where you are getting it from a different socioeconomic status. So these are something where you would have to go and look at your data, look at your systems of collection, look at how you interpret in your AI systems and build them through. So again, and that's not just about design and development. It's also about where do you go and deploy them? And are you then deploying them in the appropriate scenario for which you have built? So if you build a tool where you thought about building it for the mass screening program in Africa or somewhere in rural India or somewhere in Southeast Asia, are you then using those in those areas? Or are you then restricting yourself to certain affluent populations for which this is possibly doesn't make any sense? So those are kind of things which you have to look at it from the design, development, and deployment perspective in order to ameliorate the risk that comes out of the bias systems.
Yeah. Any questions?
Thank you, sir. It is a very wonderful and very informative session. Myself, Dr. Sarita, sir. I would like to ask you one question. How do you ensure as doctor that AI algorithms used in healthcare are transparent, fair, and unbiased? Because we are to develop AI algorithms, we should integrate very different multidisciplinary peoples as doctors, engineers, AI developers. So how can you ensure that those algorithms are transparent, fair, and unbiased? And one question, sir, one more question, sir. As a faculty, we always think about cost cutting techniques. So here, how do we can expect AI impacting the cost of healthcare services in future? Whether poor and middle class people can afford this?
Well, again, interesting question. I think I've answered this question during my talk and in my previous answers, but I'll again talk about this. The fairness, inclusivity, transparency are very, very important features of, again, I'm talking about the design, development, deployment of AI solutions, rest assured for the clinical AI that you want to use in that perspective. And the question that is there is that how do you measure those fairness? How do you measure those transparency? How do you measure this? And then these areas are now evolving. And we now have, metrics around them where we talk about the efficacy of how transparent the system has been or how effective this has been. These are on top of the conventional metrics that we see on a performance of a model, but it is happening around in that way. And that is why it is also very important that you need to take your models to different places across, the healthcare system, across the world to say and identify how they are performing in different geographical areas or in different ethnic population or different age groups or different socioeconomic conditions. And then do what we call as threshold curation or look at around how do you balance between the false positive and false negatives and provide a stable algorithm which will do your purpose that you are looking at. Now, in all of these, again, I'm reiterating one very important point. It is important for AI, at least at this point of time of deployment, that we have appropriate human in the loop when we are using it for stuffs like clinical AI or for the interpretation, so that the tools are made to take it to the doctors, who would then decide on the interpretation of these tools and say, I accept it or I don't accept it, and take that for path forward. Autonomous systems around AI, I think it's particularly in clinical AI, I think it is not at immediate or near future, though there are people who claim it, but I would say to hold on and to say, take it through with a system where AI currently assists clinicians rather than becoming completely autonomous in doing stuffs.
Thank you, Doctor. We'll try to take questions from the students.
Yes.
So, students, if any. Students, is there anybody to interact?
Hi, Doctor. I'm Kiran from Kim School of Management. Thank you for sharing your views on role of AI in healthcare industry. So, based on the questions raised by Anand Pawar sir, the cost effectiveness, and then the ma'am also questioned the same thing. The rural area people, they can't afford using these AI tools and all. It's not about cost effective, the cost concern. Any people with the Android mobile, with active mobile internet, they can use AI tools just by writing the prompts. And then for the concern of matter accuracy, it depends on the user, the way they give the prompts.
Yes.
It's not only same matter for every individual. Suppose I might give prompt in different way, and then the other person, they might give prompt in another way. So it will be based on the prompt we give it to the GPT. Also, the chat GPT, the data sets are included in chat GPT, updated the matter till September 2021 only. And then whatever the matter after 21, it's not at all updated. So chat GPT is like a general introductory, to introduce, there is a technology, we can interact with the systems and all. But now organizations are focusing on developing their own chat GPTs, particularly to their industries. If I speak about my industry, currently I'm working in pharmaceutical industry. So we have a gap analysis. Still we are facing some difficulties in finding suppliers and then effective um, customers. So while deploying my idea, maybe within 1 year, I could fill that gap in my industry.
Yeah, thank you for this question, and I see that you almost summarized my talk, and which is fantastic. No,
exactly.
I love that.
Thank you, Doctor.
So I think you were right, very very right about the generative AI and how and it's very evident that you go about in improving on the prompts by giving multiple prompts and seeing the results out of it, and how you curate the output in that way. And please understand this. This is for people who are like you, who are very advanced in their thinking and then using it in that way. But for the last mile, first of all, you talked about internet and Android, and there are still some percentage of people in India who do not have access to smartphones and and internet. And how do we take it to them? How do they get the benefit of AI in healthcare, particularly in terms of accessibility, or in particularly in triaging certain diseases and getting there? That's the constant research. That's something which we would have to discuss at different or a higher level forum between the government institutions or other institutions who actually work in those fields, and how do we make our solutions better so that they can use it and take it as they are. Now, there is a question around the cost which comes back and back, and I think I do not know if cost is, at this point of time, I'll say Cost may be an inhibitor for certain sections of society, but I think overall use of AI in healthcare, where it will pinpoint with you to appropriate diagnostic tests, where it will minimize the time of care, where it will give you pinpoint diagnosis, detection, or prediction of risk. The idea is to actually lessen the burden of healthcare, lessen the burden of cost, and that cost would have to be passed on to the patients at at some point of time. That is what is my personal thought process, and I strongly believe that that's where we are heading to.
Yeah. Thank you, Doctor. Yeah, anybody? Any questions?
That's it. I would like to supplement to Doctor, with your permission. I would like to supplement with Mr. Kiran. The clinician should not be tempted to depend completely on the AI, in the sense that AI should be supplementary to the endeavors of the clinician, and it should not be other way.
Yeah, and I agree. I completely agree. That is why I said it is an assistive function for the clinicians to make a decision. I'm not saying it helps the clinicians in making decisions, but it does not decide for the clinician.
Yes.
And that is very, very important as a perspective that, we don't forget about it. So if a clinician is missing a polyp while we do an endoscopy AI, right, in the gut, a polyp that could actually rise, and then it gives out a signal and says, I'm seeing something which is sinister. Possibly you may not have seen that. Would you like to have a look? That is where it is beneficial, right? And the physician looks at it and says, no, possibly you didn't pick up a right thing, and I don't want to, I don't think there is something sinister here. The best thing would be that we would ask this patient to go for an annual follow-up and take it from there in that way. Matter ends. But, if the AI, if it on the reversal, if it says, no, AI says, I find that this is a something which is a polyp and something where you, as per the clinical protocol, you will have to go and take a biopsy and get the biopsy results for this. I do not know how it would work. And I have spoken to various friends who are endoscopists, who do endoscopy on a daily basis. They said, no, we do not want a tool like that. A tool which triggers and says that I need to have a relook, fantastic. A tool which says what I will have to do, I'm not too sure how to go about and use it.
Yeah, at this juncture, I think we can conclude by saying AI is only can complement, but
Yes.
not alternative to any other technology or human.
Alternative to human endeavors.
Alternative to human endeavors.
Yeah. So that is what I often hear, that
Yeah.
human intelligence is better than artificial intelligence.
True, because even AI also developed by humans.
Yes, that is true.
Yeah, thank you, Doctor, for a wonderful session by you.
What we give.
Yeah. So because AI works on algorithms that human gives. Yeah.
Yes.
Now the time has come to conclude the session. Now I request Dr. Radhakrishna, Faculty of Department of Business Management, to propose formal vote of thanks.
Thank you,
Dr. Radhakrishna.
Thank you, sir. Honorable Chief Guest, Professor Sitaram Rao Garu, other degrees on the dais, Director, Team, Head of the Department, Dr. BRAOU, and the participants of the today's lecture. A very good evening to all of you. On behalf of the organizing committee, IIC, it is my privilege to propose a formal vote of thanks and acknowledge the contributions of those who worked really hard making this event a success. At the outset, I extend my wholehearted thanks to our Vice Chancellor, sir, Professor Sitaram Rao Garu, for his constant encouragement to organize programs of this nature. We are truly grateful for his leadership, sir, and taking time to join with us. And I thank you once again for your blessings. My sincere thanks to Dr. Sujay Kumar, Chief Medical Information Officer and the Vice President of Apollo, being with us in spite of his busy schedule, sir. This lecture has truly thought-provoking and opened new dimensions like responsible physical AI and users sigma in solving the problems of healthcare and algorithms and ChatGPT. Thank you, sir. I place on my sincere thanks to guest of honor, Professor Pushpa Chakrabarty ma'am, Director Academic, Professor A.V.R. Reddy Garu, for their presence and giving valuable message to the participants. I take this opportunity to especially express deep regards and gratitude to Professor Anand Pawar, Professor President IIC, its constant encouragement. And I would like to also extend sincere thanks to Professor Kiran Member Secretary IIC. Their support played a crucial role in making this event a successful. A groundwork for all this begins week back. A team IIC has been meticulously planning every detail, ensuring seamless and unforgettable experience. Their proactive approach and dedication have been driving force behind this event. We are incredibly grateful for their efforts. I would like to express sincere appreciation to Finance Department, Computer Center, EFMRC, and PRO section for their efforts and guaranteed excellent media coverage. I thank one and all for making this a grand success. Thank you. Thank you, one and all.
Thank you so much. Thank you. Thank you, one and all.
So thank you, Dr. Sujay. The only disappointment is we could not see you.
Yeah, I'll come personally and see you all.
Please, sir, please, thank you.
Please do
Thank
come.
you very
Thank you
much.
so
Thank you
much.
for
Thank you so much, sir, for
Bye.
sparing your valuable time with us.
Thank you.
Thank you so
Thank
much.
you.
Bye.